So this month I'm on the acute pain service, which functionally has two jobs throughout the day. The first and probably the busiest of our jobs is to do nerve blocks. So commonly at the beginning of the day before patients go back for their operations, we will give them nerve blocks if they're having, for example, orthopedic procedures or some sort of procedure on either an upper extremity or lower extremity. We'll also do blocks for open abdominal surgeries like tap blocks. The most common blocks that we do are probably for shoulder replacements. We'll do an interscalene or supraclavicular block. If someone is having elbow or wrist surgery, we do another brachial plexus type block that's a little bit further down the plexus. If someone is getting a knee replacement, we'll do adductor canal blocks, and if they're getting some sort of ankle procedure done, then we'll do a combination of the adductor with a popliteal block to get the whole ankle covered. The second function of our job is to check on patients in the hospital who have either epidural catheters or they have perineural catheters. And the first thing we do when we round on them is to make sure that they're getting adequate pain control. So this could involve being able to sit up in bed, taking full breaths with the incentive spirometry. We want to make sure that the catheter is functioning well and that they're getting the appropriate amount of medicine through it. The other thing we make sure is that catheter hasn't moved, so there's markings on the catheter to tell us just how deep it is. As long as it stays consistent every day and the dressing looks good, we're pretty happy with the catheter.